Where do you stand on little leaguers in how they throw, how often they throw? Because I'm sure, have seen a lot of these elbow injuries, and you've seen them with now younger and younger children. So a lot of parents listening to this program, is there some kind of words of advice from one of the great surgeons in history that could help us?
Well, that's certainly a problem that I see daily. I did 3 Tommy Johns yesterday on either freshmen in college or young high school players. And this morning I've been seeing new patients.
Wow.
And so far I've had 3 rooms I've been to seeing new patients. They're all 15, 16, 17 years of age that are playing year-round baseball and have injured their Tommy John's ligament. So the big thing for parents is anybody doing an overhead throwing sport should have at least 2 months off, preferably 3 to 4 months off each year when they're not doing an overhead sport, which means they shouldn't specialize and play 12 months out of the year. Dan, one thing that I can tell them, if they're playing and they're playing with fatigue in youth baseball, meaning vet fatigue, seasonal fatigue, or year-round fatigue, if they're doing that, there's a 36-to-1 times. That's a 3,600% increased chance of injuring their shoulder or their elbow playing youth baseball. So fatigue is the thing we have to prevent. And so how do we do that? That's the big question.
The Dan Patrick Show, weekday mornings on Audience.